Hi everyone, my name is Dr. Matt Ragan. I'm an OBGYN here at Aventa Specialized Women's Clinic in Dothan. I'm going to be doing a series of videos here just talking about average things you might want to ask your OBGYN. Maybe you're too afraid to ask, or maybe you don't have time to get to an appointment, or maybe it's just something you've always been worried about. We're going to be discussing things like birth control, endometriosis, hormone replacement therapy. The list could go on and on. So look forward to you tuning into these and maybe learning a little something new or finding out a question that you've wanted an answer for. Today we'll discuss hormonal contraception, such as birth control pills, patches, etc. The first thing we'll talk about today is combined oral contraceptive pills, also known as the birth control pill. These contain both estrogen and progesterone. They're over 99% effective if used appropriately. You take one pill daily, and most of the time they come in a pack of 28 with either 21 to 24 hormonal pills, and the rest are placebo pills, and that's when you have your cycle or your withdrawal bleed. Some patients choose to skip this withdrawal cycle section in order to skip cycles altogether. This is a fantastic option for people who have endometriosis and want to skip menses. Other outside benefits of birth control pills include treatment for endometriosis, decreased menstrual bleeding and cramping, reduced acne, reduced unwanted facial hair, and a decreased risk of ovarian cancer. Due to the estrogen, combined oral contraceptives are not ideal for some patients for several reasons. A few of those include high blood pressure, migraine headaches with aura, and a history of blood clots. Your provider should discuss these things with you before you start hormonal contraception. The next thing we'll talk about are progesterone-only pills, commonly known as the mini pill. These contain only progesterone. Just like the other birth control pill, you take one pill a day. It has the same effectiveness as estrogen-containing pills. These are beneficial for patients who, like we previously mentioned, have medical conditions that preclude them from taking estrogen-containing contraception. The most common side effect is irregular spotting, which can be attributed to the lack of estrogen, but these are still fantastic options for daily birth control. Lastly, we can talk about the transdermal patch and the vaginal ring. These both contain estrogen and progesterone and have the same effectiveness as estrogen-containing birth control pills. These are great options for somebody like me who's terrible at taking medicine every day, and you want to avoid the need for daily dosing with the same effectiveness as a regular birth control pill. For the patch, you apply one patch per week. You do this for 3 weeks out of the month, and then you take a week off to have your withdrawal cycle. You replace it somewhere on your shoulder, on your small of your back, something like that, somewhere discreet. The rings are small and flexible, and they're designed to be placed in the vagina for 3 weeks out of the month, and then they're removed the last week of the month to have the withdrawal bleed. They're easy to insert and remove, and you leave them in place during intercourse. That's a very important thing to remember. That's how you keep their effectiveness. They have the same contraindications as estrogen-containing pills, so you should speak with your OBGYN to see if these are the right choice for you. The IUD is the most commonly used type of contraception worldwide. They're a great option for women who do not want to worry about daily, weekly, or even monthly dosing of medication. They're extremely effective, they're used for several years, and they're immediately reversible. So whether you want to have a child 6 months from now or 10 years from now, they're still a great option for you. First, we'll discuss non-hormonal IUDs. The non-hormonal IUD is the copper IUD, also known as the Paragard. These are approved for 10 years of use, and they're over 99% effective. Their major mechanism for preventing pregnancy is thickening cervical mucus to prevent sperm transport. They also contain spermicidal properties. Since it's non-hormonal, it might be preferred by patients who want to avoid all types of outside hormone exposure for either medical or either personal reasons. These are also approved for use in emergency contraception up to 5 days after last intercourse. The most common side effects of these are increase in menstrual bleeding and cramping for the first several months after insertion. The majority of women report resolution of these symptoms after 6 months of use. The next type of IUD is a progesterone-containing IUD. The most common brand name is Mirena, but there are several other brand names out there. These are approved for 5 to 6 years of use, depending on the type, and they are also over 99% effective. They all contain a type of progesterone that works locally in the uterus. They also thicken cervical mucus to inhibit sperm transport. They cause a thinning of the uterine lining, which can have a side effect of affecting heavy periods. So this is actually one of those good side effects. The most common side effects are irregular spotting and cramping. Usually these subside after about 3 to 6 months. Most women will have normal cycles with a progesterone IUD, but up to 20% of women don't have a cycle at all after the first year, and up to 40% of women don't have a cycle at all after 3 years of use. Like I said, another side effect that actually could be a benefit. Next, we'll discuss the subdermal implant, also known as the Nexplanon. You've probably seen the commercials with the Armor Up. This device is approved for 3 years of use, and it's actually the most effective form of birth control, mostly because it's stuck in your arm and you can never miss a dose. It's in there. It works by thickening cervical mucus, just like the progesterone IUDs and other progesterone-containing medication, but it also can inhibit ovulation. It's inserted in the office under local anesthesia. This only takes a few minutes, and it's usually very well tolerated by patients. Removal happens in the same manner. It only takes a few minutes and is really, really easy. The last thing we'll discuss today is Depo-Provera, also known as the Depo shot or the birth control shot. This is a progesterone injection that is received in the clinic every 3 months. Depo is highly effective, but it's less effective than IUDs or Nexplanon. It works by preventing ovulation, and it also works on the uterine lining. Most women don't have a cycle at all, which makes Depo a good option for women who want to completely avoid a cycle due to heavy or painful periods. Most common side effects with Depo are irregular bleeding, or sometimes even menopause type symptoms because of preventing the ovulation, kind of shutting down ovarian function. Some women also do complain of weight gain, but most weight gain is only about 2 pounds in a year. So overall, it's a really fantastic option for women who want to avoid cycles, but also want to avoid maybe daily dosing of medication or aren't afraid of needles every 3 months. So these are all great options for controlling a cycle, maintaining fertility, or having contraception for months to years at a time, depending on your choice. If any of these options sound good to you, schedule a visit with your OBGYN and we can answer any questions you might have about them or decide if they're right for you.